Hello, I'm Barbara O'Neill. Today we're discussing a crucial health topic that often goes unnoticed, particularly in our elderly population, Transient Ischemic Attack, or TIA, commonly known as a mini-stroke. Recognising the signs early can be life-saving. Throughout this session, we'll explore the 8 signs of TIA, arranged in order of importance to help you understand why prompt action is essential. I encourage you to stay with us until the end to learn about the most significant sign, which might surprise you. So let's begin this important health journey together. Before we begin, I have exciting news to share. We've launched our exclusive Holistic Health YouTube community, where you'll get weekly remedy tutorials, healing guides, and more. As a special thank you, the first 100 members will receive a free copy of my book. Click join below to become part of this wonderful community. I can't wait to welcome you. Now let's dive into this amazing remedy together. Today we're starting with what many might not immediately connect to brain health, the 8th sign of a transient ischemic attack, sudden nausea or vomiting. When these symptoms appear unexpectedly and without any apparent cause, they can indeed be alarming. Now, why should sudden nausea or vomiting be considered a sign of something as serious as a TIA? Well, our brain, this wonderfully complex organ, not only controls thoughts and movements, but also regulates many of our automatic functions, including digestion. During a TIA, if the blood supply to the regions of the brain that manage these digestive functions is briefly interrupted, it can lead to symptoms like nausea or vomiting. It's crucial to understand that these symptoms, although common, can sometimes signal a deeper issue when they arise so abruptly, especially without the usual suspects like food issues or a stomach bug. This is particularly important for those who might be at a higher risk for strokes, such as our elderly or those with a history of heart or circulatory problems. The suddenness and inexplicable nature of these symptoms should raise immediate concerns and prompt a careful evaluation, considering their potential link to a serious neurological event. Many times, people might brush off such symptoms, attributing them to less serious health issues. However, in the context of a TIA, recognizing and responding to these signs swiftly can make a significant difference. It could very well prevent a full-blown stroke. If you or someone close to you experiences such symptoms unexpectedly, it's a wise decision to seek medical advice promptly. It's better to be cautious and have it be nothing than to ignore a potential warning sign of a TIA. Now let's proceed to discuss the next critical sign of a TIA, which can also appear subtly but has significant implications for timely medical intervention. In my experience as a health educator, I've often emphasised the importance of understanding how sudden changes in coordination or mobility can be a direct signal from our body that something is not right. Difficulty walking or experiencing sudden problems with balance and coordination can be alarming signs of a transient ischemic attack. When a TIA occurs, the temporary reduction in blood flow to the brain can affect the areas responsible for our motor skills and balance. This may manifest as sudden clumsiness, stumbling, or a feeling of being unsteady on your feet. These symptoms might occur so abruptly that they can cause an individual to be unable to walk normally, seemingly out of nowhere. It's critical to grasp that these motor disturbances, while they might seem minor or easy to brush off as just feeling off or tired, should be taken very seriously. For those at risk, particularly the elderly, these signs could be the only warning of a TIA. Recognizing them promptly can lead to quicker medical responses, which is crucial in preventing a more severe stroke. Anyone who experiences such sudden changes should consider them a red flag, especially if there are no other apparent reasons like injury or intoxication. This is not only about losing one's balance, but any sudden difficulty with walking, whether it's a lack of coordination, a dragging foot, or an unexplained need to hold on to walls or furniture for support. Additionally, the unexpected nature of these symptoms can often be unsettling, highlighting the need for immediate attention and appropriate action. Observing these signs should prompt an urgent evaluation by medical professionals to ensure that timely intervention can be provided. As we continue to discuss the signs of a TIA, remember that early detection and action are paramount. If you or someone around you shows these symptoms, it's essential to seek medical attention immediately. Not only can this help in managing the potential TIA itself, but it also serves as preventive care against possible future strokes. Next, we'll look into another sign that often goes unnoticed, but is equally important to recognise: severe headache with no known cause. I have encountered many individuals who experience headaches, but it is crucial to discern when a headache might indicate something more serious, such as a transient ischemic attack. A severe headache that appears suddenly and without any apparent trigger is particularly concerning and should never be ignored. This type of headache associated with a TIA is far from the typical tension headache or migraine. It comes on abruptly, is intense, and feels unlike any ordinary headache. It may be described as a sharp, piercing pain that peaks in intensity very quickly and occurs without the usual suspects like stress, dehydration, or dietary factors. This sudden and unexplained nature makes it a key warning sign. The cause of such a headache during a TIA lies in the disturbance of blood flow to specific areas of the brain. When certain regions are briefly deprived of adequate blood and oxygen, pain receptors in the brain's covering can be triggered, resulting in an intense and alarming headache. In some cases, individuals may also report additional symptoms, such as visual disturbances or nausea, further complicating the situation. Recognising this symptom as a possible sign of a TIA is essential, particularly since headaches are so common and often dismissed as trivial. For individuals at higher risk, such as older adults or those with cardiovascular conditions, paying close attention to the onset, intensity, and nature of a headache is key. A sudden, severe headache with no apparent cause should immediately raise red flags and prompt urgent medical consultation. It is absolutely vital not to overlook these headaches. If you or someone you know experiences such a symptom, treat it as a medical emergency. Seeking immediate medical attention can provide crucial time for evaluation and interventions that could prevent a full-blown stroke and its potentially devastating consequences. Understanding the connection between sudden severe headaches and TIAs is crucial for early recognition and prevention of further complications. Each of these signs builds a clearer picture of how vascular health impacts neurological well-being. With timely action, the risk of long-term damage can be significantly reduced. Next, let's turn our attention to dizziness or loss of balance, a symptom that can seem subtle, but is often a critical sign of a TIA. Recognising it in time can make all the difference. In my teachings on natural health, I often stress the importance of paying attention to our body's signals. Dizziness or a sudden loss of balance is not just about feeling unsteady. It can be a serious warning sign from our brain. These symptoms may indicate a transient ischemic attack, where the brain's normal blood flow is temporarily disrupted. When experiencing a TIA, the parts of the brain responsible for maintaining balance and spatial orientation can be affected. This disruption can manifest as sudden dizziness, a feeling of spinning, or a loss of balance that might cause one to stumble or have difficulty standing up straight. These episodes can be brief, but they are often intense and disorienting, making it crucial to recognise them for what they are. Some individuals may also experience additional symptoms such as nausea or blurred vision alongside the dizziness, further complicating the situation. It's important to understand that such symptoms should not be dismissed as mere fatigue or a momentary glitch in one's health. Particularly in the elderly or individuals with cardiovascular risk factors, these signs demand immediate attention. Dizziness and balance issues linked to a TIA are particularly significant because they can serve as early warnings of more severe and disabling strokes if left unaddressed. If you or someone around you experiences these symptoms unexpectedly and without a clear cause, such as medication effects, dehydration, or an inner ear problem, it's imperative to consider them as potential indicators of a TIA. Let's now shift our focus to vision problems, another indicator that is often overlooked yet critical in understanding the spectrum of TIA symptoms. These changes in eyesight can tell us a great deal about what's happening inside the brain. One of the more alarming and sudden signs of a transient ischemic attack involves changes in vision. These vision problems can manifest in various forms, from partial vision loss to complete blindness in one or both eyes. Sometimes individuals may experience blurriness, double vision, or difficulty focusing, which can come on suddenly and be extremely disorienting, especially if the individual is engaged in routine tasks like reading or driving. When a TIA occurs, if the areas of the brain that are responsible for vision processing are affected by the temporary lack of blood flow, the results can be immediate and frightening. These symptoms might include a sudden blackout of vision in one eye, often described as a curtain falling, which is a classic sign of a condition called amaurosis fugax linked to TIA. In some cases, individuals may also report seeing flashes of light or shadows that obscure their vision, further adding to the confusion. Understanding the severity of these vision changes is crucial. They are not just inconvenient, they signify a serious disruption in brain function that requires immediate medical attention. Many people might hope these symptoms pass or attribute them to other less critical conditions like eye strain, fatigue, or a migraine. However, recognizing them as potential signs of a TIA and acting swiftly can be life-saving. Now, let's focus on one-sided weakness or numbness, another critical sign of a TIA that provides further insight into the urgent need for medical evaluation. One-sided weakness or numbness is a hallmark symptom of a transient ischemic attack and often one of the most noticeable. This symptom usually affects either the left or right side of the body and can impact the face, arm, and leg. Patients often describe a sudden heaviness, tingling, or a complete lack of sensation in these areas, which can be quite alarming and disorienting. The experience can be quite distinct, as shared by a patient I once counselled. She woke up one morning to find her left arm felt completely dead, unable to move or respond to her commands. This frightening experience lasted for several minutes before gradually returning to normal. Such episodes are stark reminders of how crucial immediate medical attention is and how these transient symptoms can serve as precursors to a more severe stroke. This weakness or numbness occurs because a TIA disrupts the blood flow to parts of the brain that control motor skills and sensory input. Without prompt treatment, these temporary symptoms could precede more severe outcomes, including a full stroke. Additionally, these symptoms often leave individuals feeling vulnerable and confused, unsure of what's happening to their body. It's important for anyone experiencing or observing such symptoms to act without hesitation. Next, we delve into trouble speaking or understanding, which is another critical sign of a TIA, emphasizing the interconnectedness of our brain functions and how they manifest in our communication abilities. This can be just as alarming and deserves immediate attention. Trouble speaking or understanding is another critical sign of a TIA that emphasizes the interconnectedness of our brain functions and their impact on our communication abilities. This symptom, known medically as aphasia, involves difficulty in forming words and sentences or comprehending spoken language. It can suddenly make simple conversations frustrating and confusing, not just for the individual affected, but also for those around them. One example that vividly illustrates the impact of this symptom involves a former student of mine. During a family dinner, he suddenly found himself unable to grasp the conversation at the table or respond appropriately. His words came out jumbled and nonsensical, which was alarming for everyone present. Thankfully, his family recognised this as a possible sign of a neurological issue and quickly sought medical help. This prompt action likely prevented a more severe stroke. Aphasia in the context of a TIA is caused by a disruption in the blood flow to the areas of the brain responsible for language processing. This disruption can affect speaking, reading, writing, and understanding others. Even though these episodes may last only a few minutes, they can feel like an eternity to the person experiencing them and can be quite distressing, particularly in social settings. The implications of such speech difficulties extend beyond mere communication barriers. They can hinder an individual's ability to perform tasks that require clear verbal instructions, affect social interactions, and even impact personal safety, especially if the person needs to communicate in an emergency or explain their symptoms to someone nearby. Immediate recognition and response to these symptoms are crucial. Observing sudden changes in speech or comprehension should prompt an urgent medical evaluation. Such proactive measures not only address the immediate risk posed by a TIA, but also help in preventing potential strokes, which could have more severe and lasting consequences. Understanding the seriousness of speech difficulties and their relation to TIAs is essential for managing these symptoms effectively and safeguarding one's health. By staying informed, we can act swiftly to protect ourselves and our loved ones from the devastating effects of a full stroke. Recognizing the early signs is truly life-saving. Sudden confusion, the number one sign and most critical indicator of a transient ischemic attack, dramatically showcases the urgent need for awareness and quick response. This symptom involves an abrupt and profound disorientation regarding time, place, or identity, often leaving the individual feeling utterly lost, even in familiar surroundings. It can be accompanied by forgetfulness, trouble recognizing faces, or an inability to follow simple instructions, adding to the distress. Take, for example, an elderly gentleman from my health practice experiences. He was discovered wandering in his own garden, unable to recognize his surroundings or recall what he was doing there. Such a severe level of confusion, arising suddenly and without apparent cause, is particularly alarming. In another instance, a woman couldn't recall her own address during a routine phone call, leaving her family panicked and unsure of what was happening. This symptom arises when there is a disruption in the blood flow to the areas of the brain responsible for cognition and memory. During a TIA, if these critical regions are affected, the individual may experience sudden confusion, which can manifest as difficulty understanding their environment or performing simple tasks they could easily handle before. These moments can feel terrifying, not only for the person experiencing them, but also for their loved ones who witness the sudden change. The sudden onset of these symptoms calls for immediate medical evaluation. It is essential for caregivers and family members to recognize this as a potential emergency, as timely intervention can prevent further complications, including a full-blown stroke. Quick action, such as calling emergency services, can make a significant difference in recovery outcomes. Understanding that sudden confusion is the most telling and significant sign of a TIA empowers us to take swift and decisive action, safeguarding the health and well-being of those at risk. Raising awareness about this critical symptom can save lives and reduce the long-term impact of undiagnosed and untreated TIAs. Recognizing the signs of a transient ischemic attack is crucial for timely intervention and preventing further health complications. We've discussed the 8 most significant indicators, from sudden confusion to unexpected nausea, each pointing to the urgent need for medical attention. If you or someone you know exhibits any of these symptoms, seek medical help immediately. Don't forget to subscribe, like, and comment below if you have any questions or wish to share your experiences. Your engagement helps spread important health information that could save lives. Stay informed and vigilant.